Hi guys, it's Dr. Galante, and I want to talk to you today a little bit about sciatica. I've been treating sciatica for over 30 years, and there was a point about 10 years ago that I got very frustrated with the sciatic care that people were receiving. Oftentimes people will come in with sciatica, and they've been to half dozen doctors. They've had 2 or 3 MRIs, they've had EMGs, they've had physical therapy, they've had drugs, medications, injections, you name it. They've been through the whole gamut of the medical treatments for sciatica, and they're not any better, or they're mildly better. And they're still suffering, and their quality of life is not good. They're not sleeping well. Their mornings are rough. And this has been going on for weeks, months, sometimes years. So I got so frustrated with it that I actually wrote a book on it. I wrote a book called Sciatic Survival Guide. And in it, we talk about things you can do at home, the causes of sciatica, home treatment, as well as what we do here in the office. Now, everyone wants to know when they come in, hey, what causes this? What causes sciatica? Well, there's a lot of external causes, as you can imagine. Traumas, falls, lifting, can all cause a sciatic problem, but most of the time, people don't really know what caused it, and that's not unusual. They wake up one day, they have some pain in their back and hip, the next couple days it goes down to the leg, and a week later they can barely move. That's the most common history I hear about sciatica. But to understand why that is, you have to understand a little bit about the physiology of sciatica and what's actually happening in the back when you develop that pain. So, we look at the lumbar spine. We have the vertebra there. We know that the disc is between the vertebrae, right? And we know that the outside of the disc is made up of cartilage. The inside of the disc is made up of a jelly-like substance, a fluid-like substance. And we also know the nerve comes right out behind that disc. So the nerve comes down here and goes all the way down to your toes. So no matter what the external cause that caused the pain, what's happening in the spine is there's increased pressure. There's increased pressure on the disc, and there's increased pressure on the nerve. So if you can see this, I don't know if you can see this model very well, but there's an example of a disc herniation here. And what happens with a disc herniation is this fluid-like substance herniates out and puts pressure on the nerve right here. And that causes referred pain all the way, can go all the way down to the foot. Sometimes it's just in the hip and thigh, sometimes it goes all the way down to the foot. And if you've ever had sciatica, you know it can cause pain, numbness, tingling, even weakness in more severe cases. So when you have a case like this, especially if it's interfering with the quality of your life, especially if you can't work, you want a solution to this. You want quick relief. You want it to last a long period of time, and you don't want any residual problems. So one way not to have any residual problems is we want to keep you away from opioids. Now, when you're in severe sciatica, sometimes you need a short course of opioids, but we don't want that to be a routine, and we certainly want to avoid the addiction to opioids, which is a problem for so many. We know from studies that 59% of people that die of opioid addiction started with back pain. So this is a very serious condition, very serious condition. So if you've been to the medical doctor and you've had medication, non-steroidal anti-inflammatories, you've had steroids, maybe you've had injections, you've had a couple rounds of physical therapy and it's not helping, please understand you do have other options. There are other ways to treat this, and very, very effectively. So what we need to do with a case like this is where that pressure is, we need to get the pressure off the disc, and we need to get the pressure off the nerve. And when we evaluate a patient, the first thing we need to do is we need to figure out if we can help them. Because some people do need immediate surgery. So if we evaluate a patient and we find out that they're not a candidate for our treatments and they do need surgery or they need another procedure, we send them out for that immediately. Because sciatica is nothing to play around with. It's a very serious condition. Now, if we accept a patient and we can help them, we do manipulation, we do physical therapy modalities, orthotics, laser therapy, whole body standing vibration, bracing, spinal bracing, decompressive bracing. We do any combination of those treatments, but the main treatment we do is the Cox technique. Now, what the Cox technique is a gentle, painless procedure to decompress the discs. Everyone who treats sciatica is trying to decompress the disc and decompress the nerve. That's why when you go to the surgeon, they do a decompressive laminectomy or a decompressive surgery to get the pressure off. We just do it differently, without drugs, without surgery, without opioids, without injections. And basically what's happening with the Cox technique is when you have a herniated disc and you have pressure on that nerve, we're going to gently open that up. And we know it works because when they studied this, they found that when we perform the Cox technique, we create a negative pressure on the disc by negative 192 millimeters of mercury. It's also been shown to open up the area where the nerve comes out by 28%. So we're going to give that nerve a third more room, basically 30% more room, so it's not being pinched or irritated and causing that, what we call that radicular pain down the leg. So when we start treating someone, that's the first thing we see is the pressure comes off the nerve and that leg pain starts to ease up. So that's usually the first thing we see. Now, as I mentioned, sciatica is a very serious condition. We want to stay away from opioids at all costs, and we want to get people back to their normal lives and improve the quality of their lives. So if you or a loved one are suffering with sciatica, let's sit down and talk. Bring in your x-rays, bring in your MRIs, bring in your EMGs, all the tests you've had. Let's see if we can help. If we can help you, we're going to put together a treatment plan for you, and we're going to talk about exactly what we're going to do, how long it's going to take, what it's going to cost. If we can't help you, we'll point you in the right direction, help you find someone else that can. So if you're suffering, let's sit down and talk. Thanks, and be well.